I would like to invite Dr. Dweej Shah. So he is going to talk about, eye as a window to your subconscious. So over to Dr. Shah.
Hello. Thank you, everyone. Thank you, sir. I am Dr. Dweej Shah from Sankar Foundation Eye Hospital, Visakhapatnam. This year only I completed my DNB, so I am just new and very fresh for this talk. Thank you for giving me the dais for the youngs. This is just my observation in my residency period, and I think it will fit in neurophthal. Eye as a window to your subconscious. We as ophthalmologists constantly have eye contact of the patient. By all instruments, we are observing different parts of eye on a micro level. So that is the reason ophthalmology should require a psychiatric concern. Eye is also so much expressive, and from the Indian culture and everywhere we are using in Bharatanatyam also so where that eye is so much expressive. And as a all psychiatry patient with a headache, they are coming to ophthalmologist mainly all the time. So that social stigma is there, they are coming to ophthalmologist, so we need to find a way to diagnose that kind of patients also. So why is our eye so much expressive? Most of the movements controlled involuntarily, giving maximum space in the cortex. 90% of the information transmitted to the brain is visual, and it is processed 60,000 times faster in a brain than other text. 40% of nerve fibers are linked to the retina. More than 50% of cortex and surface of the brain is developed processing visual information. So this much importance given in the brain for our visual impairment, and it is transparent not only for light, it is transparent for your emotions also. That will come very fastly outside. These all are the information regarding eye. And the second reason is, as patients are not going to psychiatry, they will come to our specialty only. I will like to focus on the 4 components I have observed which can be linked to the psychiatry in our eye. First is pupillary reaction. Not just limited to ICUs and RAPD, pupils should be reacted to the reaction of the light. That basic rule is more the size, more the attention. If you are giving more attention, your pupil size will be dilated. That is a known fact. We can implement that in any scenario, mainly in online shopping. If front camera is on, we can see the pupil size, and if you are interested more, that product you are liking, you can use like that. Study has carried out closely related pupil size in different intelligence. So more intelligence, more pupillary size also for known fact. Extraocular movement. Looking towards the door outside. While in the talk, if you're looking constantly at the door, I should understand that you are not interested in the talk, you want to go out. So according to that, there are so many studies has done, and according to the eye position, we can find out if patient is telling truth or not. We can diagnose from that. If patient is telling he has used glaucoma medication, but he is taking saying down and saying, that means he is saying lying. So many facial expressions according to the eyes also they have known. Blinking and tear film already associated with the hormones and the psychological and psychiatry with the depression and the other related disorders. There is a dry eyes and associated with the psychiatric disorder already known. Eyebrows, micro expressions. According to the patient eyebrows, we can see micro expressions, and micro expressions are very known facts and used in the different kind of scenarios for the criminal. And it is involuntary movements of the muscle of the face occurs a reaction of any emotion, and we can find out on the eyebrows mainly. So that also we can use for the further implementation in the, we can use with the psychiatry and the criminal to diagnose the clinical psychology. So my conclusion, I want to implement a new pioneer or something like requirement of a psycho to study further with the other branches of the medicine. Increase. Right now there is so many layers in the personalities of the market also, so that we can give in the market also some new branch, so that can lead to increase in the understanding of the patient, and both medical and commercially we can use this branch as a further new pioneer. Thank you.
Thank you so much, Dweej. That was a very interesting talk. I think in the next decade we'll have some ocular psychiatry coming up with you in the branch.
There is actually a lot of work going on, especially among dyslexic children, about eye movements, being able to assess their abilities, their fields, and try to enhance areas where they lack. So absolutely, I think it's a very interesting talk. It really opens our mind through our eyes to look for things that may help us in the future. So absolutely, thank you very much, Dweej. It was interesting, and I hope it leads to more research in our field. We are lacking good instrumentations that are specifically devised for neuro-ophthalmology. Thank you, Dweej. We'll go on to Dr.